Silver Linings Playbook by Hugo Bilsing, Nick Tessalona, and Taryn Garrett. Describing Patrick Solitano, Bradley Cooper plays the role of Patrick "Pat" Solitano in the movie Silver Linings Playbook, a man who is diagnosed with bipolar disorder. Pat was a happily married schoolteacher until he arrived home one day to find his wife in the shower with another man while their wedding video was playing. Acting out of rage, Pat nearly beat the man to death and was put into a mental institution, while receiving a restraining order from his wife in the school he taught at. You can see how he is bipolar with his random episodes and highs and lows. Anything that comes to Pat's mind, he talks about and says. He exercises so that he feels in control of his life and to lose weight for his wife. He does everything for his wife Nikki so she'll take him back. His father has bipolar disorder as well and is very explosive. And Pat has episodes where he hears his wedding song, and sometimes he hears it when it is not even playing. Psychological disorder to be diagnosed. Pat is diagnosed with bipolar disorder. This disorder has symptoms such as alternating between two poles of high and low emotions. Depressive episodes also come along with this disorder, and episodes can last between 4 and 7 days. Things like inflated self-esteem, decreased need for sleep, talkative, flights of ideas, and increase in goal-driven activity all may show in someone who had this disorder. In the DSM-5, the relevant category is bipolar and relative disorders. Support your diagnosis. Pat shows manic episodes when triggered by the song that was played at his wedding. These episodes cause him to be extremely mad and frantic, immediately followed by him apologizing sincerely and even crying. Pat also showed stages where he would be very talkative and upbeat, usually concerning him being closer to earning back his wife's affection. These timely mood swings characterize bipolar disorder. Missing symptom. Although Pat covered the basis to be considered bipolar, he lacked any sign of depression in his disorder. His episodes only range from angry and frustrated to jovial and talkative. Possible treatment. In the movie, Patrick is prescribed medication for his bipolar disorder, but doesn't take it. He experiences the mental health hospital, which doesn't seem beneficial to his bipolar disorder because he refused to take those drugs. Because Patrick exhibits symptoms of bipolar disorder, he would benefit from medication that would not make him groggy or foggy. He would also benefit from continuing meeting with a therapist to help him deal with the feelings he experiences. He should regulate his lifestyle, stay healthy, and keep drug and alcohol consumption to a minimum. Another important thing he should do is maintain a strong family and friend system. The projected outcome of his treatment would decrease his emotional episodes and less mood swings. These treatment methods are appropriated for his disorder because they offer him the most normal life he can have and keep his episodes from getting out of control. The main ethical concern with treatment of bipolar disorder is that the medication prescribed is thought to make the patient not act like himself, or that the patient would feel froggy and distant from the world. This is a common misunderstanding, and there are many different types of medications that allow the patient to live a perfectly happy life without feeling desensitized. Psychological disorders in film. I believe that bipolar disorder is portrayed well in this movie. Patrick experiences a distant period of abnormally and persistently elevated, expansive, or irritable mood and abnormally and persistently increased goal-directed activity or energy. He has outbursts of intense emotion after reading books, when a certain song comes on, or when he is asked about his ex-wife. This is followed by a period of him regretting his outbursts and apologizing for being out of control. He is extremely focused on getting in shape because his wife told him that controlling his weight would help his condition. He also is very focused on communicating with his ex-wife after he leaves the mental hospital. His main focus is giving her to love him again, so he does everything he can to make that happen. He is very talkative and often finds himself saying way more than he should. He has fits of being extremely distracted by unimportant things. He has racing thoughts often and has flashbacks of unpleasant experiences that upset him. He is also very goal-driven and has intense outbursts of violence and anger when he cannot accomplish that goal. This movie portrays bipolar disorder as a very violent disorder. Patrick has multiple fights with his father, accidentally hurts his mother, and gets into a public fight. While a person who really has bipolar disorder may have violent outbursts, the movie exaggerates them and puts a lot of emphasis on the fact that these violent episodes happen.